We're just giving it a couple minutes to let people come in, get into the room.
See him coming in.
Okay, so I just wanted to welcome everyone to the A4LE webinar, Clean Away Confusion Around Flooring, and then take a moment to introduce John Sumlin, Vice President of Tarkett, their Educational Division.
Okay, great. Carla, thank you so much. So welcome to the webinar. Today, we're going to take about an hour of your time to talk a little bit about flooring and how you clean. This is an AIA accredited presentation, One Health, Safety, Welfare, and One Learning Unit. We're not sure that everybody knows how to define cleaning today when it comes to flooring. As an expert in the creation of healthy spaces, we want to clean away confusion around flooring and help you reopen your facility with confidence. Attend to learn more about cleaning, sanitizing, disinfecting solutions that can help you safeguard health and wellness of your space. So the general learning objectives today will be a brief background in history, the industry position on use of disinfectants and sanitizers on resilient and soft surface flooring, an overview of other organizations on cleaning and disinfecting for the COVID-19, the CDC and EPA list of disinfectants for COVID-19 and guidelines for cleaning and disinfecting surfaces, and antimicrobial treatments content for flooring surfaces in the context of COVID-19. Our subject matter experts today have over 50 years of experience in the flooring business. Andy Baylor is an IICRC certified master textile cleaner and is an ICRA master cleaner in textiles. He is also a flooring inspector with FCITS. He currently sits on the revision council of both the IICRC commercial carpet cleaning technician course and the ANSI IICRC S100 standard for professional cleaning of textile floor coverings. Andy lives in the Atlanta area with his wife and twin sons. Dave Hibbert, our second subject matter expert, is a senior technical coordinator for Tarkett with more than 17 years of experience. Dave currently provides technical support in many areas via our technical hotline, technical specifications, installation, maintenance, marketing support, testing, and environmental sustainability. In addition, he has over 13 years of experience in product development with various thermoset thermoplastic polymer processes. He is currently an active member of the ASTM F06 Committee on Resilient Flooring. David resides in Ohio and has a grown child that is not in the house, which has helped him during the COVID. I am your facilitator, John Sumlin. I work for Tarkett as their education segment leader. I've got about 30 years of experience cultivating strategic markets. I'm an active board committee member with A4LE, Schools Next, University of Tulsa Indoor Air Program, the Collaborative for High Performance Schools, current board member and ex-com member, as well as the APA ANSI Committee on Total Cost of Ownership Standards Development, which was APA and ANSI. I live in Atlanta, Georgia, and have 2 grown sons. So we are going to jump into content now. I'm going to bring up my PowerPoint, and I'm going to ask Dave Hibbert to start us off, and we're going to start with the resilient side of the business. But before I do, Dave, I want to make sure that if you have any questions, if you know how to operate Zoom, there's a Q&A box to please type in your questions there, and I'll monitor that and try to answer them as we go along, or we'll answer them at the end there. And if you type them there, it's also going to allow this recorded presentation to include those questions, which will help those folks that watch it as a recording. So without further ado, I'm going to hand over to Dave Hibbert and let him begin the presentation. Thank you.
Thank you, John. Yes. Yeah, I appreciate everybody's time today, and hope that we can help provide a better understanding of maintaining resilient and carpet flooring in light of this pandemic. So some of the key points that I'm going to talk about would be the concerns of SARS-CoV-2 virus that's associated with COVID-19 disease. We'll talk a little bit about that. We'll also talk about what other organizations are saying. And that's one thing we did a little research, set in on a couple of webinars, and just to get an idea of what people are doing. The other thing is the use of disinfectants. That's a common question nowadays on resilient flooring, as well as soft surfaces, which Andy will talk further about that. Also, we'll talk a little bit about CDC recommendations, their guidelines for cleaning and the use of disinfectants. So we'll start with the discussion with the virus. We'll get a little bit of science here. In general, the concerns is going to be the SARS-CoV-2, and in reality, the virus is just another part of the coronaviruses. There's been many out there, so the overall genome structures are pretty much the same. The only difference would be like the protein, the spike proteins that you see on the very ends of this picture that tend to be slightly different. So in terms of the concerns is that we get is there's many concerns about how to mitigate this, and the concerns of flooring. How can we safely protect people in the spaces, as well as what is going to protect the floor as well. So we're talking about a very small microscopic parasite that infects a living cell of a host. So it basically directs the cell machinery to produce more viruses. And as this process continues, the damage to the host, which occurs in turns, cause symptoms and respiratory health issues that can be detrimental. So when we're looking at the viruses in terms of the size, I thought this was interesting when comparing small things. For me, it's hard to understand when we're comparing even large things, like when we talk about light years across in astronomy, when we're looking at nebulas or things that are just exorbitantly large. It's hard to fathom what that means when you look through a telescope. I would say the same goes through microscopes when you're looking at tiny blood cells, bacteria, viruses. We're talking about very microscopic, things that we don't know exist. We don't see it. So if we kind of look at in terms of size, a micron would be basically 1/1,000,000th of a meter. So if I take a meter and divide that by 1,000,000 in 1,000,000 pieces, take one of those, that's 1 micron. You could also look at like $1 million. If I had $1 million, I give you $1. That's basically the size that you've given me of that $1 million. So one reason I bring this up is because when we're trying to mitigate this virus, and we've got to keep in mind that this is less than half the size of a bacteria. So this chart here, I found this chart. I thought it was kind of interesting. We look at ground coffee. Ground coffee is basically 400 micrograms or microns, and then we look at beach on the sand. Like a sandy beach could be anywhere from fine to medium sand is going to be 125 to 250 microns. Table salt is approximately 100 microns. Human hair pollen is about 50 to 70 microns. If we drop down to white blood cells, they're 25 microns, down to red blood cells at 8 microns, and then down to bacteria at 2 microns. So finally, when you get to SARS-CoV-2 and many other viruses, they're in that range of 0.06 to 1.1 microns. So we're talking about, if I pull out that $1 million and I give you some change or up to $1.40, that's about how much in terms of size we're looking at. Very small, and obviously that's the major concern. So ISSA had an article on their website, and basically, if you're not familiar with ISSA, they're a worldwide association for the cleaning industry that's been around for about 97 years. ISSA had this article on their website from the Restoration Industry Association, which is RIA, and the Institute of Inspection, Cleaning, and Restoration Certification, which is the IICRC. They collaborated and put together a 10-page comprehensive guide for restoration contractors in response of the COVID-19 pandemic. So I pulled out some of the bullet points I thought that were interesting. Now, they said applying the disinfectant are important risk mitigation techniques. Later, you'll see that there's other recommendations for, looking at more of the maintenance side of it versus the disinfectant. Another important thing to realize is the terminology when we talk about clean and disinfect. We want to say, that you're applying a cleaner, so you're applying the disinfectant. So we clean the floor and then we apply a disinfectant, because we don't want to use the terminology clean and disinfect just for the misunderstanding that you're 100% clearing the floor of any type of virus or bacteria, which that's not the case. So because of that, they said that there's no way for the contractor to know the appropriate level of microbial reduction that has been reached in order to meet the definition of clean and disinfect. So contractors are very careful in terms of using that terminology, because obviously we know we can't mitigate completely 100%. They also mentioned about providing services in workspaces and public building generally requires a risk assessment to protect workers from biological, chemical, and safety hazard. And I think that's important, that number one, you understand what risk assessment is, and going in to evaluate, whatever, when you have a service coming in, you want to make sure they know what they're doing and get their recommendation. Also, they talked about choosing a sanitizing product can be confusing, as sudden onset of SARS-CoV-2 virus means that commonly used antimicrobial products have not been tested and have not received a U.S. Environmental Protection Agency's registration. So basically, we're talking about sanitizing type products. We're not talking about disinfecting products. These are products that in the flooring industry, there's companies that do sell or have sold floors that were antimicrobial, as that's how they would promote it. So going back to the EPA, their emerging pathogen program, that's where you're going to find whether it's effective or not. And I think in this case, we would kind of question when SARS-CoV-2 came out, it's like, how can you guarantee that that's going to help you protect, people from getting sick? Okay, so ISSA offers tip sheets on their website, and I pulled this off. This was the facility management reopening tip sheet. And basically they said that further levels of professional disinfection or decontamination could be needed if known cases emerge in your facility. So obviously this is part of that risk assessment to making sure that you are ready for this type of scenario. So therefore, as part of the risk assessment, ask your provider to explain what levels of cleaning they identify as normal, heightened awareness, and infected surface decontamination scenarios, as well as their protocols and training at each level. So ISSA recommends that your cleaning provider should have at least one person who has gone through the GBAC fundamentals, which is the Global Biorisk Advisory Council, the fundamentals course to understand the biorisk professionals, what they recommend to be considered when creating, cleaning, and disinfecting protocols for COVID-19. So ISSA also provides some definitions in terms of functions of cleaning. These are recommended levels of approach by most governmental authorities to address the SARS-CoV-2. I'll start with the cleaning definition is basically, they say it's to removal of soil, such as dust, dirt, and debris. Often it can produce 90%, or it can actually provide 90% reduction in disease-causing germs. So that's something to keep in mind, 90% reduction. Cleaning prepares a surface or item for disinfection. So at this point, we're looking at 90% removal of most disease-causing germs. And then the next step, if you want to go to the next step, if there's a need to, then we go into the disinfection. So sanitizing says it lowers the level of biological agents of an object to a safe level, known as 99.93 log reduction of disease-causing germs. So in terms of logarithm, now we'll go back to math. So it's kind of like if we look at if there's a 4 log versus a 3 log, it's exponentially much greater. So if we look at disinfecting, the process eliminates many or all pathogenic microorganisms except bacterial spores on inanimate surfaces. So what they mean by this is pathogenic microorganisms would be like a disease-causing virus such as the COVID-19 pandemic that we currently have. They say except bacterial spores, and from what I read about that was that a bacterial spore can survive in adverse conditions and for many years. So that's very difficult. So we also attended a symposium by Siri, and it basically they covered a lot of subjects from risk management. They talked about what you need to know about the pandemic, how and why we test, high performance cleaning, meeting the challenges associated with effective disinfection, preparing for the next pandemic. So within that symposium, this is some of the notes I pulled out. There was a presentation by Greg Whiteley. He's an adjunct fellow of the School of Medicine of Western Sydney University. He mentioned a quote by a doctor that he knew that said, cleaning is the process of removing unwanted soils and microorganisms. So again, it kind of reinforces the fact that cleaning is very important, and that we'll get into the frequency as well. It's going to be very important of cleaning your floor. Coronaviruses, in bullet point 2, coronaviruses have individual characteristics, but all are susceptible to disinfectants. So that goes back to SARS-CoV-1, goes to the MERS, and then the current SARS-CoV-2. So the end user's choice of disinfectant should mirror the facility's cleaning protocols, not just your favorite supplier. So that's really important because again, we're going to go back to, we'll talk a little bit about the EPA, and Andy will get more in depth with the EPA's in list of recommendations. But everything goes back to the CDC. Let's see. Bullet point 4, there are critical constraints for effective disinfectant use, such as soils, biofilms, and dead microbes. So again, this reinforces the importance of cleaning before you disinfect. Otherwise, you're going to be less likely to be effective with just a disinfectant. The RIA, the IICRC, and also the AIHA, which is the American Industrial Hygiene Association, released their 4th edition in regards to the COVID-19 pandemic. This was something recent, and this is something that was written for the professional cleaning and restoration contractors. And something I noted out of there, they said that mopping, damp mopping, and other wet wiping methods, as well as dust control materials like microfiber mops and cloths may be appropriate for floors. Methods that are not recommended include regular vacuuming, dust mopping, sweeping, or other methods that can easily aerosolize viral fragments along with other unwanted dust. So, okay, so the CDC guidelines for disinfection and sterilization in the healthcare facilities came out in 2008, and it was again updated in 2019. And you got to think back in 2003, we had SARS-CoV, and then again we had the MERS, which was in 2012. And I believe if we kind of look at the science behind it again, it still stands that this document still is effective. So I pulled out some key points out of their document. One was that surfaces such as flooring are considered non-critical. So we'll get into this whole idea of how do you define critical, non-critical. Well, more than 30 years ago, Earl H. Spalding, he devised a rational approach to disinfection and sterilization of patient care items and equipment. And he believed that the nature of disinfection could be understood readily if instruments and items for patients were categorized, such as critical, semi-critical, and non-critical. So flooring would be considered non-critical. So that's an important point to keep in mind as we talk about disinfecting a space, because obviously there's other more critical areas that would be a concern. Daycare could be obviously a concern, but then a policy may be warranted to be changed in a case like that. Use of non-critical items on contact with non-critical surfaces carries little risk of causing an infection in patients or staff. So that was what they found. They also found that non-critical environment surfaces included bed rails, some food utensils, bed tables, patient furniture, and floors. So it's interesting how they group those items together. Um, Here's an interesting investigation they did with, and this is going back a ways. I would imagine phenolic was more of the common disinfectant back when this was written, but they did talk about that cleaning a hospital floor using soap and water. They found that it was about an 80% reduction. I don't know how they calculate that, but that was their finding. It was less effective in reducing the number of bacteria than was a phenolic disinfectant, which was closer to 94 to 99.9%. Okay, so they said, however, they found that after a few hours of disinfection, the bacteria count was nearly back to the pre-treatment level. So we're not talking necessarily about viruses, but we are talking about bacteria. So keep that in mind. They also said investigators have shown that mop water becomes increasingly dirty during cleaning and becomes contaminated with soap and water if used rather than a disinfectant. So obviously the disinfectant in the water would obviously make a difference in your mop water. But however, they also talk about changing out your mop water in your mops. It says here that mop water solution should be changed every 3 patient rooms in no less than 60-minute intervals or according to the facility's policy. In addition, the use of microfiber mops improved cleanability and with disinfectants. And that's kind of a common theme today that we're finding. Everybody is pretty much using the microfiber mops. If you're not, I mean, that's something that you really need to look into. So recently, CDC also came out, they just recently published this, and I just pulled out, again, some excerpts that relate to resilient flooring. And of course, PPE, personal protective equipment, is important, wearing gloves to clean and disinfect. And they also, again, reinforced that clean surfaces using soap and water, then disinfect. So it's not just flooring, but they're also referring to other surfaces as well. Cleaning with soap and water reduces the number of germs, dirt, and impurities on the surface. Disinfecting kills germs on the surface. They talk a little bit about disinfecting, and so the EPA has a list of disinfectants as well, and we'll get into that. One thing I noticed that they said, which was important, the reason I pulled this out is in the underneath many products recommended, it says keeps surface wet for a period of time, see product label. So that's going to be important if they're using a disinfectant. And it's also important when they're using cleaners. Cleaners have surfactants that help break down dirt. And I'll talk about that a little bit more. So this is actually from the EPA has the N list of it's a disinfectant list of products, not necessarily just for floors. And one thing they said, while disinfectant products on this have not been tested specifically against SARS-CoV-2, they expect it to be effective against SARS-CoV-2 because they have been tested on and proven effective on either a harder to kill virus or against another human coronavirus similar to SARS-CoV-2. So I think everybody can look at the science and agree that we're not concerned that the disinfectant may not work. I think they're pretty confident it worked to a degree. So again, we got to be careful of when we say to what degree that would be. So RFCI came out, their TAC members provided a memo back in April, and this was regarding the CDC's recommendations on cleaning and disinfection and the impact on resilient flooring. The memo was primarily addressing like healthcare industry, but basically I pulled out some key points out of there as well. They said, although flooring isn't considered a touch point with respect to COVID-19, the concern is that the contaminated floors are walked on by someone, get tracked into their vehicle, and then their home. So obviously, there's going to be a trail regardless. We can also talk about hospitals where you have a nurse walking from room to room and the room has been disinfected, well, there's a good chance it's going to be recontaminated. The second bullet says it should be noted that a study of installed materials used in healthcare that manufacturer cleaning and maintenance recommendations were not and are not what healthcare facilities are utilizing in their organizations. So in many cases, they have their own protocols, and they basically will also refer to CDC in their recommendations. And also they talked about cleaning and disinfection guidelines that come from CDC, referencing the Environmental Protection Agency list, which is the N list of the disinfectant chemicals, which again, Andy will address in more detail. Cleaning is necessary step of any disinfectant process. Again, now RFCI is also saying that. They said if a surface is not cleaned first, basically the success of the disinfectant process can be compromised. There's also a generic disinfectant chemical list in this document, which is basically acquired through the CDC recommendations. So when we get into maintaining resilient flooring, kind of make some points here that number one, perform a routine daily cleaning procedure per the applicable products maintenance instructions to remove any existing soil, inorganic and organic matter or debris that can inhibit disinfection procedures. The use of microfiber type mops, which can be more effective to remove microbial agents, while frequently changing mop heads to prevent recontamination. So again, kind of look at the CDC's recommendation for hospitals. You could just kind of look at that for your particular space. And obviously, the more you change your mop head, the more frequently that you clean a floor, the cleaner the floor is going to be. Let's see. Yeah, I'll make a point too that the frequency of damp mopping and the use of an auto scrubber even is going to be very important based on the foot traffic, and that's part of the assessment. You would have to look at what areas, whether it's an entranceway, corridor, specific room, you know, what type of traffic is being tracked into that area, and then you have to set your frequency of maintenance based on that. And the other thing is the use of microfiber mops is best for removal of existing soil, organic and inorganic matter. That's important because studies have shown that the old string mops just don't do that well of a job. Okay. Now, I'll also point out that there's, in the last bullet point, we talk about testing selected disinfectants in an inconspicuous area, which is, it's a good idea to do. However, we have to be careful that some of these are going to be long-term issues. So I'll make a point about ammonium chloride is a product that's used in quaternary type disinfectants, and it can actually discolor your floor over time. So the resilient flooring industry would call that like a quat burn. And that's caused because they didn't rinse the floor. So it's important that the disinfectant that's being used, if they're going to use it, is going to be something that can be rinsed afterwards. So, and they also will have a dwell time, which is going to be important. So pay special attention to rinsing instructions found on the product label. And that's basically what I was just talking about, that many times I've seen customers complain about their floor being yellowish in color, and then we find out that they either used some other type of disinfectant or a quaternary type, and they never rinse it, and that's just the way they do it. So it's important that they understand and talk with the manufacturer of that product so they know that they're properly using it correctly so it doesn't damage their floor. So the responsibility for suitability of the use of the selected disinfectant or cleaning product on your flooring is the responsibility of the disinfectant cleaning products manufacturer and also the discretion of the end user. So that would be, our concern is just the use of the disinfectant. There's nothing wrong with using disinfectants, but keep in mind, there's a time and a place to use them. So part of that risk assessment, I would say, would be based on whether you really need it in that space, or if more frequent maintenance would be more sufficient in that space. So I'll summarize here. U.S. use resources such as the CDC, the EPA, and for Canada, the IPAC, or the Government of Canada website on coronavirus disease, and internal policies. Clean floor prior to using a disinfectant. Rinse thoroughly to prevent damage of the flooring. Follow the manufacturer's recommendation for proper use. of the disinfectant they want to use for their resilient floor. So that ends my presentation. I'll hand it over to Andy.
Thanks,
Great.
Dave. Great presentation. Folks, my name's Andy Baylor. I'm the Soft Surface Product Care Manager for Tarket. What I'll be covering is the industry position on the use of disinfectants and sanitizers on soft surface flooring, the CDC and CDC's position and the EPA list of disinfectants and the recommended guidelines for cleaning and the use of disinfectants, how to read list N, which Dave alluded to a few times, and then sources for further guidance as this subject matter changes, which has been quite a bit over the course of the last few months. I got sent home from work on March 17th. St. Patrick's Day was my last day in the office, and that's when I dove in head first to reading and understanding list N. And at that time, I think there were 140 items on the list. I believe there's now over 400. So you can see in a relatively short period of time, things have evolved quite a bit. As Dave's excellent presentation pointed out quite a few things, there's going to be some redundancy between these two, but there's definitely distinct differences between how hard, non-porous surfaces are treated versus soft surfaces containing fiber like carpet are handled. So surfaces are still considered non-critical because they are a low touch point. They are not handled like doorknobs and keyboards and light switches and such. Use of non-critical items or contact with non-critical surfaces carry little risk of causing infection in patients or staff. Non-critical surfaces include bed rails, as Dave discussed, bed rails, some food utensils, and floors. The food utensils is confusing. I'd like to understand exactly which food utensils would be considered non-critical, but at any rate, floors are definitely part of that. So what the CDC's statement is on flooring specifically and soft surfaces specifically, for items such as carpet, the CDC recommends removing visible contamination if present and cleaning with appropriate cleaners as indicated for use on these surfaces. So we'll get into a little bit more depth exactly what that means in future slides, but essentially clean the carpet. So soft surface flooring cannot be disinfected per CDC guidance, nor does it need to be, as we have discussed. It just needs to be cleaned. So these are some pretty important distinctions here. So you know, we're worried about more cleaning the surfaces as opposed to sanitization or disinfection. An important measure that you know we're looking at recommendation on, especially in early childhood education. This is a slide that the World Health Organization has put out recently, more in reference to homes, but I would say that it applies to early childhood education. Leave shoes outside the classroom whenever possible and whenever practical. You know we walk through a lot of different things during the course of the day, not just in relationship to coronavirus or COVID-19. This will stem a lot of different things. It will prevent the migration of soil throughout a facility, but also any potential pathogens that may be on the bottom of an individual's shoes. So I believe that this is just a good practice. I mean, that's what Grandma always told me anyway. So moving forward, there again is no necessity to disinfect soft surface per the CDC guidance. Furthermore, use of disinfectant on soft surface flooring in a lot of cases will cause damage in the form of color damage, color loss, chalking, and loss of tensile strength of the fiber. So there's an organization called the Carpet and Rug Institute, and what they do is they test for a lot of different things with equipment and chemistry, and they make sure that what is being used on the carpet isn't going to cause damage to the carpet. So if desired, Carpet and Rug Institute seal of approval sanitizer may be applied after proper cleaning has occurred. Again, it is possible, however, that long-term use of sanitizer, even a Carpet and Rug seal of approval sanitizer, might still possibly cause fiber damage issues. There is research that is ongoing in relationship to that, however. So there's always new possibilities around the corner on items such as this. So what does proper carpet cleaning involve? It involves carpet vacuuming with a Carpet and Rug Institute approved vacuum cleaner, HEPA, whenever possible. Application of a Carpet and Rug Institute approved pre-treatment and mechanical agitation, appropriate dwell time per the chemistry manufacturer's instructions. Dave alluded to that as well. You have to read the instructions and see how long the cleaning solution is supposed to stay in contact with the surface that you're cleaning. And then hot water extraction with fresh water or a rinsing agent. And then additional dry vacuum passes for maximum moisture removal. So my last bullet point here, hot water extraction provides carriage by current or rinsing that other cleaning and maintenance methods do not. This is something that's kind of important. Dave mentioned a symposium that we sat on back in March that was hosted by Siri. There's a gentleman that was part of that had been involved with the cleaning efforts in West Africa during the Ebola outbreak. And they determined using ATP meters that the best cleaning methods for the patient treatment areas during the Ebola outbreaks involved hot soapy water and rinsing, or carriage by current. So good old-fashioned hot water and soap will perform a reduction in the viral pathogen levels. There's also, if you advance to the next slide here, there is also some new information coming forth from ISSA that any sort of soap or detergent will inactivate the coronavirus by dissolving the lipid bilayer that envelops the virus. Now, this is not just in relationship to carpet, mind you. This is in relationship to any surface that is being cleaned with a traditional cleaner. Now, so we're not talking about disinfectants and we're not talking about sanitizers here. We're talking about good old-fashioned soap and water. So this is analogous to hand washing. Remember, in the very beginning of this outbreak, everybody was on television every 5 minutes saying, wash your hands, wash your hands, wash your hands. It's true. Please do wash your hands. And as soon as we're done with this presentation, I would like everybody to get up from their desks and go wash their hands. I will. But when we're talking about washing floors, washing countertops, and washing carpet, the soap or the detergent that is doing the work is washing away pathogens, but it is also breaking down that lipid bilayer that is involved and rendering the virus inactive. So here we talk about the EPA COVID-19 disinfectant list. List N, it is, Dave alluded to this as well. The products on the list have not been tested specifically against SARS-CoV-2, but are expected to be effective against the virus because they have been tested and proven effective on other harder to kill viruses or against other human coronavirus similar to SARS-CoV-2. As of 7/31/2020, there are 469 List N chemicals. So this next table that comes up here on the next slide is a kind of a how-to. It tells you the EPA register number, the active ingredients, the product name, the company that manufactures it, and the contact time, the dwell time that is required for it to be effective. So bear in mind that when you're applying the chemical, if you're fogging, you're probably not going to get 10 minutes worth of dwell time out of that product. Fogging is a very, very popular method for application of different disinfectants. There will be different methods also on the label instructions. So it's best to note here that on list N, there are no instructions for use. That's going to be on the container. There are no surface suggestions on the list. The dwell times vary widely, and the label name may vary from the list N name. So I guarantee you that very first one there, the product is called LPH8SE. That's not what it says on the jug. It says, it'll say something else, manufactured by the Steris Corporation, and whatever it says on the label is the law. And to deviate from that might actually be in violation of a federal law somewhere. RIA and IICRC have put out a report. It is very, very important to clean prior to the application of a disinfectant or a sanitizer, regardless of what surface you're working on. Dave mentioned this as well. And it is impossible for the contractor to know that if the appropriate level of microbial reduction has been reached. Now, what can be done is an inspection using an ATP meter. I mentioned that earlier in the presentation. An ATP meter measures adenosine triphosphate. And what that is something that is, it is a material that is in everything biological. So it can be measured prior to cleaning and post cleaning to see how large of a reduction of ATP has taken place during the cleaning process. And if the people occupying that space are satisfied with the reduction level, you know, that's one good way to measure the efficacy of the cleaning process. So again, in this same report, risk assessment is very important to protect the workers and the general public in the building from both the biological, chemical, and the safety hazards. And choosing the appropriate sanitizing product, it can be confusing as the sudden onset of SARS-CoV-2 means that commonly used antimicrobial products have not been tested and received a US EPA registration. There are so many on that list right now, there is really not any reason to use something that is not on the EPA register list. So I don't have a recap slide. This is to basically put you in contact with additional resources. So make sure that your personnel have been properly trained on PPE. Make sure that you're using resources like the CDC, the EPA, World Health Organization, IPAC, which is the Canadian and Government of Canada website on coronavirus disease and internal policies. Use the ISSA and IICRC, CIRI, RIA, and CRI for additional training. Always follow the chemistry manufacturer recommendation for proper use of sanitizer, and remember the label is the law. And clean carpet thoroughly. Use sanitizer only after cleaning has been performed. But remember, sanitizing is not something that needs to be done on a daily basis. General cleaning and maintenance is all that is necessary to maintain a healthy environment.
Great, Andy. Are you done there?
That's all I have.
Well, awesome. Well, we really appreciate that. We've got some questions. I'm going to bring them up actually on screen so that we can then put it out to the panel and see. So I'll take them in order that they were received. It looks like, yes, the first one from Josh. Is there any points of sanitizing UV with the use of an auto scrubber? So I guess that's UV and an auto scrubber. Do you guys have any comments or best practices on that?
Yeah, I'm not familiar with those type of systems, so I really can't comment on that.
So ultraviolet light, we're currently doing some research as to whether or not the wavelengths that are currently available on the market will cause damage in the form of color loss and tensile strength damage to carpet fiber. I'm not aware of any research going on right now with Resilient. I do know that there are some ultraviolet lights on the market that are actually designed as curing instruments when being used in conjunction with the application of like permanent top coats and that kind of thing, like replacing or repairing like a wear layer on LVT. However, we're not entirely sure what the long-term effects of ultraviolet will be on carpet fiber. It's one of those things that we're afraid that use it now, and you may end up 5-10 years down the road experiencing issues with damage to the carpet.
In the exposure that I have had, and which is just from being around facility people and buildings during this time, is that they're using it with HVAC systems and ductwork. So we can't really comment on flooring other than what we have, but I know that the ASHRAE and the HVAC people might have some more specific information on that. So the next question is, would Tarkett recommend disinfectants for use against COVID-19 for their flooring products? So I think we answered that, but give me a good response back just to reconfirm that response.
Yeah, I think we're going back to the CDC recommendations of use of disinfectants. So we kind of go back to, in our stance, or as a resilient flooring company, we're going to be careful. We don't want the floor to be damaged. So again, that's going to be a concern. But since we can't test every possible disinfectant, we have to rely on, number one, that the product is going to be effective on the virus. That's number one. So CDC will provide that recommendation using EPA's guidelines. We would say follow those guidelines and find something that's suitable. Even RFCI has recommendations for specific disinfectants. And then the main thing is that you rinse the floor, and generally it's going to be like a disinfectant is going to be like a quaternary type formula. But again, it would be important to rinse the floor when it's done. So that would be our recommendation.
Awesome. Okay. Another one that came up, and this was previous to the presentation, is, and maybe Dave, you can comment first, and then Andy, as far as modularity of flooring for those that are not always involved in flooring, but we have products that come in pieces that are assembled on the floor, and we have products that come in sheets. Comment quickly on your category as far as, for disinfecting or sanitizing an area. What is the best material type you recommend?
Well, I think if we use healthcare as a model, generally like in a operating theater, they're going to want the most sanitary condition possible. So in that case, they're going to use a homogeneous sheet vinyl product that's heat welded. And then they can also flash COVID up the wall so that they can have a large cove and prevent any, areas that could be contaminated when you clean a floor, that it's going to be cleaned thoroughly because you have a nice smooth floor. You don't have any crevices or areas that you'd be concerned about microscopic type, viruses or bacteria. I mean, that's going to happen regardless. And I would think in many cases, tiles and plank flooring is going to be fine too. But if we're looking at the most effective floor, then I would say homogeneous sheet vinyl that's heat welded.
Great. Andy?
Yeah, there's sheet carpet as well that creates a wall-to-wall moisture barrier with like chemically welded seams that makes a completely impervious system wall to wall. So essentially it could be moisture bearing from the top and the bottom. Ideally, that would be something that you would default to from the start. However, even the modular systems, carpet tile and such as that, our research has found that it's just a minimal amount of soiling and that kind of thing, makes it through those really tight seams and crevices. But essentially, sheet carpet with the welded seams are ideal for environments like that.
Great. This is a kind of a comment and a question. Interesting about the shoes with early childhood. Child care licensing has issues with children having shoes off while in care. Has this information been presented to the child care licensing? Not aware of it. It's a good point, but that's a good question for us. I know that in Europe and also in Asia, there's a lot of culturally shoes are left at the door. And so there is a long-standing thought process about bringing contaminants in, but not aware of that one. So not aware of the presentation. Good point. So I'll do that one. Another one has come in with the tape that's being used on floors for social distancing. What is the best way to remove that residue? And we'll do the same thing, maybe Dave and then
Yeah.
Andy.
Yeah, so that's becoming a question we get, and we basically approach it as number one, ideally you'd hope there was wax on the floor or floor finish, several coats, that way it makes it easier to remove. There's also a product that I know we've mentioned, it's XL North 4200 cleaner, and that's something that's actually good for tape residue on resilient flooring. So basically that's what we would say, look for a company like XL North. They do have a product that does work.
In terms of carpet fiber and adhesive residue, it can be a challenge. Unfortunately, there's no wax on carpet fiber or finish. So there, oftentimes when you pull up those markers, you're going to be left with residue. There are a couple of manufacturers for some good dry solvent cleaners. One is called Bane Clean, BANE KLENE. The other one is Clean Right, KLENERITE. Those have to, the instructions on those have to be followed very closely. You can't deviate from the instructions on those. However, I would say that with the carpet that has the wall-to-wall moisture barrier, they do have options for cutting in and permanently installing wayfinding in those. So with this being a long-term situation, it may be best to consider permanently installing some of the spacing options, and then at a later time, if it needs to be reversed, you go back and you cut out the wayfinding and reinstall different patterns or whatever instead.
Great. Okay, I'm going to read this one because it's very specific. I thought that most surface sanitizers that are effective against SARS-CoV-2 are not effective on carpet, is they only are effective against common staph infections. So Andy, is that enough information for you to answer?
Not really. So here's the big confusion about the differences between disinfectant and sanitizing and how it all relates to carpet. Okay, so you cannot disinfect carpet. It can't be done because it is considered a porous surface. However, to sanitize carpet, many times you have to use a disinfectant chemical on it. The disinfectant behaves like a sanitizer. It's almost as if it's an off-label prescription, right? Your doctor may prescribe you something, one type of medicine, and it has a different effect on you, okay? So the list N disinfectants, you may be able to go through that list of list N disinfectants and find a dozen or two that have instructions for use on carpet. However, they were originally designed for use on hard, non-porous surfaces. They are, when they are used on porous surfaces, they will behave as sanitizers. Now, here comes the really confusing part. Out of all of the 400 and however many there are on list N, there is only one that is on the Carpet and Rug Institute seal of approval list. So it gets really narrow at that point in time. So you have to be very careful about what you put on your carpet, because you don't want to put something on your carpet that is going to cause color loss, tensile strength damage, et cetera, et cetera.
Great. So the way I answered that for the webinar was the contact Andy directly. It is, as you can tell, a conversation. So we had a great recommendation as far as wayfinding, and this is something that's been used for years. Is the Velcro tape, which comes in many colors, is a loop. And if you're familiar with Velcro, there's a hook and a loop. You use the hook side, the hook tape, to then connect to the soft surface, and that allows you to create those, and they're removable and there's no adhesive. So you could preserve your investment and still put in markers. So that is a great suggestion. And let's see. So I answered that live. And then I think on Jeff's last question, I think Andy answered that. And what we would do is refer anybody who wants more specifics on sanitization and disinfection of soft surface, because it is it's not an easy one to do, to contact Andy Baylor directly. Here are our contact emails, which hopefully are easy. It's our first name, last name with a period in the middle, at tarket.com. We really appreciate everyone attending. And if you have any questions, you can email myself as a facilitator, and I can work directly with A4LE if it's a question specific to their needs or specifically to the content. So I think that's it. There was one more question that popped up, but I think it's still the same one that's listed there that I just spoke through. So thanks again, everybody, and have a great day.
Thanks, folks.
Thank you, guys.
Thanks, guys.
Thank you.